Hello friends, welcome to Dr. Ossai Physiology Academy, DOPA for short. This is a place where we make the learning of physiology easy, exciting, and effective. Thank you for joining me. If you're new to this channel, you're especially welcome. And if you love the content that we share, kindly click the like button and also the subscribe button. And don't forget to turn on notifications so that you don't get to miss any new content that we share. Now let's get started. So today we're going to be dealing with the physiology of GIT disorders. Now, physiology deals with the mechanisms that allow the body to function the way it functions. But disorders is now telling you about a problem in physiological processes and mechanisms. So that disorders has to do with pathology. Sometimes we link physiology and pathology. That's normal functioning and abnormal functioning. I will call it pathophysiology. Okay? So we will not go deep into it because that's the aspect of pathology, medicine. We are still going to, there's a branch of medicine called gastroenterology. Studied everything about the GIT, the problems in the GIT and how to solve them. Okay, so that's not what we focus mainly on. But just for you to appreciate the physiology of the GIT, we'll now tell you some of the problems that can arise due to some failure of those basic functions that we have been studying from the beginning. Okay, so that's just what we're going to do. Now, we're going to take it systematically. You know, we talked about 4 cardinal functions of the GIT. Motility, secretion, digestion, and absorption. So we're going to be looking at the disorders, the problems that can arise from these 4 different aspects of GIT function. So we're starting with motility disorders, part 1. Okay, just briefly. So we're going to look at 4 major. We'll do touch 2 of them briefly today in this part 1. One of them is called Achalasia. Achalasia. Another one is called GERD. This is a short form. It means gastroesophageal reflux disease. G-E, let me put this in capital, R-D, gastroesophageal reflux disease. So we're going to touch these 2 right now in this part 1. So achalasia, we're going to just do a definition and we'll talk about what could be the cause. Then what are the symptoms? That's how does it manifest? And you say, probably this is the problem that we're dealing with. This is the problem that is manifesting. That's what symptoms is talking about, the manifestation that you can see, that someone will complain to you, I'm feeling this way. That's symptoms. Then treatment, how can you treat them or manage them? Okay, so achalasia is just simply failure to relax. That's how the name was gotten, failure to relax. And what is failing to relax? We're starting from up, down. Now, remember that the GIT is divided into different compartments through sphincters. You have the upper esophageal sphincter, lower. Now, this achalasia, there's a problem with the lower part of the esophagus. Most of the time, the lower 1/3, okay, of the esophagus that is going towards the stomach. And it also affects the lower esophageal sphincter. And this problem is a failure of the muscles there to relax well. Because when food starts getting to that terminal part of the esophagus, first of all, it pushes the food and then opens up. The sphincter opens up so that food can pass into the stomach. But in this case, there is failure of that process to happen. Failure of the lower esophageal sphincter to relax. Okay? So, in fact, the conclusion of the whole matter about this achalasia is that there is damage to that segment, the lower part, everything. And you know that for smooth muscles to relax or contract, they are controlled by nerves. So the real problem that's happening there is that there is some damage that has happened to the myenteric. Remember that the myenteric plexus is what controls the muscles, the longitudinal smooth muscle and circular smooth muscle, the myenteric plexus, also known as the Albach's plexus. So there is a problem, damage to the myenteric plexus in that region, just that region. Okay? So now food cannot pass. It cannot contract well and relax to allow food to. It doesn't just function. So what do you think will happen? Now, food now begins to accumulate at that lower esophagus. It cannot pass through. It begins to accumulate. And as it begins to accumulate, it enlarges that lower esophagus. That's why sometimes we also call it mega esophagus. That lead to what we call mega esophagus due to its enlargement. Okay? So what do you think causes this particular problem? The truth of the matter is that nobody is sure. We are not really sure what causes the damage. Okay? It's as a result of damage of the myenteric plexus in that region. But there are speculations. The likely causes, likely implication is that what is implicated in this problem is usually autoimmune diseases. Autoimmune diseases means autoimmune diseases. Autoimmune diseases affect different things in the body. It's talking about the fact that the immune system is there to protect you and to fight, and it does that by fighting foreign agents that try to harm you. But autoimmune means that it is now fighting itself. The body, this immune system, immune cells that should fight foreign agents and protect you. Now they are now fighting you, yourself, your own body. That's what autoimmune. So it's very likely that the body now goes and instead of protecting itself, it's now seeing that myenteric plexus in that area as a foreign agent. So it's a very crazy disorder, immune diseases. So it's now fighting the nerves, they are destroying the nerves, and they no longer function. That's what causes achalasia. So what could be the symptoms? One of them is what we call dysphagia. Dysphagia means difficulty in swallowing. Difficulty in swallowing. People who have this kind of thing, they always feel that something is stuck in their throat. Dysphagia, difficulty in swallowing. There's also what we call heartburn. call it heart burn due to the location, okay, around this place. There's this burning sensation. Or you can call it chest pain. People they can complain to you as chest pain. All right? So these are some of the symptoms. Another thing also is that you begin to experience weight loss, which is very easy to understand. Yeah, the food is not going down. It's being stuck there. Okay? So these are some of the things that you can complain about. Common symptoms of achalasia. Now you now ask yourself, how do you treat it? Number one, it can be managed. It cannot be cured. Okay? This plexus there has been destroyed. You can't go and replace it. You can't manufacture the nerves that will be there to perform the function. So there are surgical ways and other ways that you can manage based on your understanding of the anatomy and the physiology of that area. Okay? So there are three major approaches that are used in the management or treatment of achalasia. The most common one and quite effective is what we call myotomy. Myotomy. Okay? So myotomy means a cut in muscle. So it means that you go to that muscle there because they are not relaxing. So you create incision. When you create incision on the muscle, you now help it to relax. It makes it easier for it to relax and food can pass. But because myotomy, you can apply to different areas. It's, to be more specific, call it the HELLA. HELLA's myotomy. HELLER. It was invented, that procedure was invented by a man known as Ernst Heller. Okay, Ernst Heller in 1913 invented that very important procedure on how to deal with that, creating incision. Okay, it's from the outer side though. You know, the inner part of the esophagus is the mucosa. That's not where you go from. From the outer side, you create incisions to release the muscle. Okay? So after this break, we're going to deal with the other two procedures that help to manage this achalasia. Right? Welcome back. So we are dealing with how to manage achalasia. We've talked about myotomy, Heller's myotomy. Now, number two, that's what we call pneumatic dilation or dilatation. Pneumatic dilation. Wow. From pneuma, how all this has to do with air, wind, pneuma. Okay? So pneumatic dilation simply means this is how it happens. There's special types of balloons, okay, that you insert. Okay, there's a procedure through endoscopy and all of that. You insert it into that region, and then you now inflate the balloon to open up and stretch out that region. Okay, so it's dilating it by applying pressure through that balloon. So you're pumping air into the balloon and it's distending and dilating that segment to now make it lax. Okay, to make it slack and lax so that that's what happens. Pneumatic dilation. Okay, just need to know that. Then number three, that's what we call Botox. Botox is a chemical substance. Botulinum toxin is a short form, meaning botulinum. Botulinum toxin. You wonder, toxin, is toxin not dangerous? When given in the right way and in the right dose, can be applied medically to solve certain problems. So botulinum toxin comes from a microorganism known as Clostridium botulinum. Okay? It's a microorganism that releases this toxin. So we extract this toxin and call it Botox. So you inject that toxin. What it does is that it really helps to relax the muscle. What it mimics the way the nerves function. When the nerves, they release dilator substances that helps to dilate and relax muscles. Okay, they are constrictor substances, neurotransmitters that help to contract muscle. There are others that help to inhibit that contraction. So that's what it does. That toxin just helps. So they go there and inject the toxin around that area, and it helps the muscle to relax. So these are the three ways in which achalasia can be treated and the patient is helped. All right. So now let's go to GERD, gastroesophageal reflux disease. Now, reflux is, what does it talk about? It simply means from the word reflux that something is going back. You know, the direction of flow is always from the mouth down to the anus. Everything, it should flow down. But reflux is talking about something is going in the opposite direction. Gastroesophageal, that's from the stomach. Gastro. Food content is going the opposite direction down to the esophagus. And this is simply what it means, the definition. It's the movement of stomach contents into the lower esophagus. And why is that a problem? Now, as you already know, the stomach is where a lot of acid is released. Very concentrated acid. But because the stomach is designed to do that, the stomach has protective mechanisms that help to guard against the corrosive effect of hydrochloric acid that is released. But the esophagus does not have those protective mechanisms, those mucus and the tight junctions, okay, that protect it. The esophagus does not have those protective mechanisms. So when there is reflux, stomach contents, they go up to the esophagus. This corrosion happens. Okay? So a similar symptom, very common complaint, is heartburn. Okay? Heartburn as a result of the corrosive effect of hydrochloric acid on the mucosa of the esophagus. It's burning it up. Corrosiveness. Okay? So that's just what GERD is all about. Acid. So how do we solve the problem? It's very straightforward. You have the medical solution. You have the surgical solution. So when we talk about medical solution, we're talking about chemical substances, drugs that can solve the problem. Surgical solution, we're talking about using physical manipulation of the organs. Sometimes you cut something out. Sometimes you attach something. You sew. That's surgery for you. Okay? So medical. The problem is acid going to affect the esophagus. So to correct that, you can decide to reduce the amount of acid that's being secreted. And because in physiology we've understood one of the ways in which acid secretion is stimulated. And one of that ways is what? Is through histamine. Talk about the enterochromaffin-like cells, okay, that release histamine, that acts on H2 receptors. That's histamine receptors on the parietal cells. Okay, when they attach to H2 receptors, acid secretion is stimulated. Okay, so when you block these receptors, histamine cannot attach to them again, and they cannot stimulate the parietal cells to secrete acid. So the drug that you give, they are called H2 receptor blockers. Okay? H2 receptor blockers. A very typical example of that is called cimetidine. Cimetidine. Another one is called ranitidine. Okay? They help to reduce the acid and it relieves the person of that burning, discomforting symptom. All right? So now surgical. How do we use physical manipulations to help this patient? Surgical solution. It's called fundoplication. That's the surgical procedure used to reduce the effect of this heartburn on the esophagus. And this is now from the word fundoplication. Remember that the stomach is divided into different parts, okay? Pyloric part, antrum, and fundus. So the fundus is the upper part of the stomach. So fundoplication simply means attaching the upper part of the stomach to the esophagus. You understand? Is just trying to tell you that this is the esophagus that leads to the stomach. Okay? The stomach. Because the stomach has protective mechanism, this esophagus, this lower esophagus that it goes to this place and causes problem, does not have the protective mechanism. So you now take a part of the stomach and you attach it here to protect the esophagus. That's what fundoplication is all about. It's a surgical procedure. And when you do that, problem solved. So that is how you solve this gastroesophageal reflux disease. Very straightforward, very easy. Okay? Disorders of motility. Now I have a book on gastrointestinal physiology. Everything I'm talking about here, they are there. So for further reading, you can check the description box. You see the link to the soft copy of the book. You can download it just for a token. And not only gastro, other aspects of physiology, 7 different books on other areas of physiology as at the time of this recording. The links are also there. Anyone you want, download it and to help you. Easy to read, easy to understand texts. All right? So also there, you see a link to our website so you can get to be informed about different things we do to make the learning of physiology easy, exciting, and effective. See you in the next video.